Hi, I'm Vet Zara, and today we're going to talk all about worms. So worming is an essential part of responsible pet care. Not only do worms cause a problem for your pets, but they're also, majority of them, transferable to people. This is particularly important if you have children, because children are a little less careful when it comes to washing their hands after handling pets. So when it comes to worms, they can live in 3 different areas in the body. They can live in the gut, they can migrate to the lungs, or to the heart. Now today we're just going to focus on the gut worms, and that's because they're the most commonly found worms in dogs and cats today. Starting with gut worms, there are 4 different types of gut worm. You've got roundworm, tapeworm, hookworm, and whipworm. So how do you know if you've got a problem? Roundworms you will see in your dog's feces or your cat's feces, and they tend to be like long pieces of spaghetti. It's not pleasant, but once you see them, you know you have a problem and you can then treat for it. Tapeworm is the second gut worm, and tapeworm can grow up to several feet in length in your dog or your cat's intestines. How you know you have a problem is if you see little small, like pieces of grains of rice, either on the poo or sticking to the fur around the bottom. And that's because each tapeworm is made up of hundreds of little tiny segments, and it's the little segments that you'll see coming out. Tapeworm is also transmitted by fleas to dogs and to cats. And cats can also pick up both roundworm and tapeworm if they hunt through rodents. The 2 remaining types of gutworm are whipworm and hookworm. And unfortunately, these are too small for you to really see in the feces. They can cause problems of the blood, like anemia. And the way that you'll notice this is if your puppy or your kitten in particular has pale gums. Now you know if you've got worms, how do you treat for them? There are lots of different ways of treating, but many of them come in either a paste, like this one, which is good for puppies and kittens, and it comes in a little syringe, and you treat once a day for 3 days by mouth. Other methods are spot-on treatments like this, and this is particularly good for cats that don't like to take pills. And finally, you've also got options like tablets. And these tablets, there's a dog one and that's a cat one, can be given directly into the mouth of your dog or your cat. Some of them are even made to be chewable and enticing that your dog or cat will want to eat. So once you've treated, how often do you need to continue treating? Well, prevention is always better than cure. So we always recommend puppies and kittens to start treatment from as little as 2-4 weeks of age, all the way through every 2 weeks until they're 16 weeks of age. And this is because puppies and kittens can get infected through their mums, either when they're still in the womb or when they're suckling through the teats. Once your puppy and kitten has reached 16 weeks of age, or around 4 months, they can then transfer across to adult treatment frequency. And that tends to be between 3 or 6 months on a regular basis throughout the year. So I hope that's answered some of your questions about mainly the gut worms that your dogs or cats can get. If you've got any other queries or you want to find out about lungworm or heartworm, then have a look through the website and find the videos there. You'll also find some articles that give you some more in-depth information. But never forget, prevention is always better than cure.